present a case. She was having a severe varus deformity of the knee. 70-year female with bilateral varus deformity, known case of diabetic hypertensive. This was the preoperative X-ray. Severe varus deformity and the medial defect. And this is a walking video, almost 20-30 degree of deformity of both knee, and this video shows the more deformity on the left side, varus and valgus instability, and the question arises whether to go for simultaneous bilateral TKR or stage TKR with tourniquet or without tourniquet, normal knee, with intermediate rod, without intermediate rod, semi-constrained or hinge knee. I gone for a stage total knee replacement, did a left side because of the left side deformity was much more, so I operated on left side more. This was the posterior medial defect I found peroperatively. Simply I applied the primary PS knee, and because of the much bone defect, I used the dot technique of fixing the bone graft on the medial side. 4 months of post-surgery, patient came for the right side TKR. And this was the pre-operative video. Now she has the hope of a smile in the face, that she will become all right. The opposite side also, I used a PS knee with the same technique of bone grafting. And this was the immediate post-operative X-ray of the next day, immediate post-operative walking. And after 4 months, she came in the OPD. After that, I lost the follow-up. This was the another case, the bilateral varus deformity. Patient came with walking, with full weight bearing, but when I did the X-ray, I found there was a fracture on one side. In today's era, we are having robotics, we can have very easily done, but this X-ray is of in 2010, 14 years before. So I did a simply total knee replacement with a leg screw fixation. Only thing is, while operating on the fractured side, I made a simple drill bit hole, and I negotiated the intermediary rod while taking the distal femoral cut, and this was the post-operative after 1 month of the flexion X-ray. This is one another case. Parvati, 70-year female, presented with neglected fractured neck of femur, almost bedridden for 6 years, developed severe osteoporosis due to inactivity. The same patient, this is the X-ray, severe osteoporosis, non-union fractured neck of femur. This is the right side of knee, and this is of the left side of knee with osteoporotic fracture. So the question arises how to proceed. So I did the total hip replacement first. On the next day, the left side of total knee replacement and the fracture side fixed with the LCP plate. And because I had the bone graft at that time, I put the bone graft. A 3-month follow-up X-ray showing good sign of union, and after 6 months showing complete fracture union with good alignment. And after 6 months on left side, right side of total knee replacement has been done. This is the right view. And since I lost the link, patient is walking perfectly, climbing stairs. And this is another case of stiff knee. Rheumatoid patient, 62-year female, and almost 14-15 years follow-up this patient. This was operated in 2012. very stiff knee. While opening, I could not find the joint line, in fact. So, with the blindly, I did the osteotomy with a little bit sparing the posterior margin, and do the osteotomy with the osteotome and open up. Nowadays, all these are easy because of using robots and computer assisted surgery, but this was more than decades before. And this is the post-operative X-ray, and this is the correction of the deformity. Thank you.